Please take their seats. This is the Senate Standing Committee on Health and Welfare, meeting number 10. The date is Wednesday, March the 16th, 2022. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll. Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Here. All right, we have a quorum and we're established to do business. We're going to go, I believe, in order on these bills. We're going to start first with House Bill 240. It's an act relating to remote access to pharmacy databases. Sponsor is Representative Danny Bentley. Representative Bentley, if you'd like to come forward, introduce yourself. If you have any guests, please have them introduce themselves. And the floor is yours.
Good morning. I'm Jim Musser. I'm the Vice President for Policy and Government Relations at the Kentucky Hospital Association.
Good morning. I'm Representative Danny R. Bentley, District 98 in the Great Commonwealth of Kentucky. This bill, House Bill 240, is very straightforward. Last year, House Bill 219 inadvertently swept the hospitals and a few manufacturers into a pharmacy data entry provision of that bill. This bill simply corrects that accidental inclusion.
Very persuasive, Representative. We have a motion and we have a second on the bill. Any questions or the discussion? Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll. Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 7-0. We have a motion for consent. You have a motion. Is there a second? Second. You have a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? The matter goes on consent.
Thank you, Mr. Chairman. Thank you, committee.
Thank you. Congratulations.
Thank you.
Next on the agenda is House Bill 316. This is an act relating to cancer awareness. Sponsor is Representative Brandon Reed. Representative, if you'd like to introduce yourself and your guest for the record. And welcome to our committee, and the floor is yours.
Thank you, Mr. Chairman, honorable members of this prestigious committee. Thank you for having us here today. I'm Representative Reed, State Representative for District 24, and I'll allow my guest to introduce herself.
I'm Teresa Metton. Was it on? I'm Teresa Metton. I'm the president and founder of the Candace Metton DIPG Research Foundation, and I appreciate all of you giving me a little bit of your time this morning.
Thank you, Mr. Chairman. Section 1 simply establishes DIPG Day as May 17th in the Commonwealth of Kentucky. Section 2 is this will be cited as the Candace Metton Act. At this time, Mr. Chairman, I would like for my guest to tell her story and why we're doing this.
Please proceed.
Thank you. DIPG stands for diffuse intrinsic pontine gliomas, and they affect children primarily between the ages of 4 and 10. They are located, not to get too technical, but they're located in the pons area on the brainstem. So they can't surgically remove it because of the risk to the patient. And at this time, there is no accepted standard of care for these tumors. So that being said, all we're asking for is a day of recognition so that we can advocate for these children and be their voices, especially since some of their voices are silent. My granddaughter passed away in 2011. So that is why that's important, is just to get that out so that we can raise money for research and hopefully find better treatments, better drugs, and ultimately a cure.
Thank you very much. For those who don't know, this is a very devastating diagnosis, and it's typically in children. And we had a young man, and I think I made a post of it years ago, that came to visit us here. Who had this, and within a matter of months, it was a day on the Capitol. I think it was really kind of neat to watch him go through it, but in short order, he succumbed to this as well. And when people talk about gliomas, they think, oh, this is a brain issue, it's a brain tumor. It's more of a diffuse, there's no way to extract it surgically. It's a non-operative diagnosis and often terminal. It's very difficult to deal with. So we appreciate you bringing this forward.
Thank you.
Any questions or comments? We have a motion and a second on the bill. Any other questions? If not, Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll. Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes.
Aye.
Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 9-0. We have a motion for consent. Is there a second? We have a second. All those in favor, please signify by saying aye. Anyone opposed? Matter is on consent. Congratulations.
Thank you.
Thank
Appreciate
you all so much.
Thank you
Appreciate
very
it.
much. I know we've had a few members join us here coming from Appropriations and Revenue. We want to cast a vote on House Bill 240. Are there any members that wish to cast a vote? Senator Givens?
Mr. Chairman, I would love to cast an aye vote. If it's appropriate for that to go on consent, I would be glad to make that motion.
Thank you, sir. It is on consent, and we appreciate that. Senator Nemes?
I'd like to vote aye also.
An aye vote on 240. Senator Carroll? Also an aye vote on 240. Very good. We'll make a note of that in the record. Next on the agenda, we have House Bill 525, an act relating to community health workers. The sponsor is Chairwoman Kimberly Mosier. Chairwoman, if you'd like to come forward, introduce yourself and your guests for the record. This is a very important topic that we've had an opportunity to hear about in the interim and has been discussed for several years. I know it's a point of particular passion for you as well. So if you'd like to introduce yourselves and begin your testimony when you're ready.
Thank you, Mr. Chair. Thank you, committee, for giving us a few minutes this morning. I am Representative Kim Mosier from the 64th District, and I will allow my guests to introduce themselves.
I'm Paul Zarapata, president of the Kentucky Community and Technical College System.
I'm Pam Spradling. I'm the Director of Strategic Planning and Development for Big Sandy Healthcare.
Okay, so we do have a committee sub.
Very good. So there's a committee sub before us. Or it's a... So you're referring to the amendment? Are you referring, or is there a...
If the chair,
Yes, I believe we have a committee amendment, and the
That's
reason why we made it an amendment is just to make sure that sometimes when we produce substitutes, people think there's things that are being thrown in at the last second, and that's not the case. There's a committee amendment before us so that we could see it. We'll roll it into the bill once this is completed. But if you'd like to explain what the amendment does briefly so that members are aware.
absolutely. So in the bill, in Section 5 or subsection 5B rather, all we're doing is striking some language that discusses that the cost incurred by an MCO to employ a community health worker be an administrative cost. Right now, those are charged and billed as medical cost, and so this just makes it part of the MLR.
Thank you. And that's to comply, I think, with federal
It is.
standards
Thank
and
you.
rules is part of the reason for this. And if you look at, you can see that lines 8 through 11 on page 4 deleted, in that whole section is deleted in their entirety. And it's just clean up language to make sure that we're not violating any federal laws. So with that, we'll entertain a motion on the amendment. We have a motion. There's a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right. The amendment has been adopted. Please proceed.
Thank you, Mr. Chairman. So House Bill 525 simply discusses community health workers. And first of all, just as background, community health workers are certified frontline healthcare workers with a uniquely close relationship to and understanding of the community that they serve. They serve as a liaison to between patients, their healthcare providers, social service providers, and the community. They facilitate improved communication between patients and their healthcare providers. They help patients learn to effectively comply with medical care instructions. They improve health literacy, and they educate patients to improve healthy behaviors. This legislation, number one, expands the community health worker program that we have pockets of in the state right now, and primarily they started as pilots, have expanded a little bit, but this expands the community health worker program to a statewide navigation system and really assists patients with a sometimes complicated healthcare system, as we all know. And then number two, it addresses the healthcare worker shortage by partnering with KCTCS to award college credit in addition to the CHW certification. And the idea is that individuals not only get their certification, they get college credit, and it expands the healthcare worker pipeline and career pathway into healthcare-related fields of study. Right now, 1/3 of Kentucky's population, or 1.6 million individuals, are currently enrolled in Medicaid, and we still see high rates of diabetes, heart disease, cancer. And what this does is really it's a targeted approach to using our Medicaid dollars effectively for programs that we know work. Just by way of history, the Kentucky Home Place Study, through the Kentucky Office of Rural Health at UK, has successfully piloted these CHW programs for nearly 20 years, and they show an $11.30 return on investment for every $1 spent in Medicaid dollars. So again, we know that this is a program that works. This is to be funded through either a state plan amendment, a blended kind of braided funding model through state, federal, and possibly public-private partnership dollars. And again, the amendment took care of the MCO's issue with the medical billing. There are many reasons why patients do or don't get health care, and I'd like to hand that bit of this conversation off to my guest, and we're available for any questions.
Hi, good morning, and thank you for hearing us this morning. At Big Sandy Healthcare, we've employed CHWs since 2017. We currently have 9 CHWs on our staff who work individually with patients, but also work as part of the patient's care team. So we work with providers and sort of serve as a liaison between the provider and the patient in order to extend the recommendations from the provider and also to assist our patients with barriers that they have in managing chronic conditions, particularly. So many of those chronic conditions are related to social determinants of health. For instance, as a provider, and some of you are providers this morning, I know Senator Alvarado, I'm sure you tell your diabetes patients, I would like for you to eat a healthy diet. That's how you're going to maintain or to control your diabetes. But if that patient can't afford healthy foods like fruits, vegetables, healthy meats, whole grains, which we know are more expensive types of foods because we all grocery shop every week, and we know that those are expensive foods. And for our patients who are on SNAP benefits, or maybe don't qualify if they fall through the crack of SNAP benefits and other assistance, it's really difficult sometimes for them to access healthy foods. I work in Eastern Kentucky, Big Sandy Healthcare. We serve 5 counties of very rural Eastern Kentucky. If you go to Grethel, Kentucky, the home of Eula Hall Health Center, you will not find a grocery store. You will barely find a convenience store, and most of those don't carry these healthy foods. So it's really difficult in these food deserts, as we might call them, for people to even find those healthy foods. So at Big Sandy, that's one of the things that our community health workers can do, is they can bridge access to those resources for our patients who need to manage those chronic conditions. In participating in a CHW project with Marshall University over the last few years, my CHWs have worked with over 400 patients who have chronic conditions, and as many as 62% of those patients with diabetes reduce their A1C by an average of 2.5 points. When CHWs work with patients at high risk for complications of chronic disease, we reduce emergency department visits and hospitalizations and realize cost savings. Over a 17-month period, our Marshall University cohort reduced the number of ED visits among enrolled patients by 93% and reduced total hospitalizations by 82%. That is cost savings, folks. We all know that. After seeing these results, Medicaid managed care organizations in West Virginia stepped up to provide per patient, per month reimbursement for chronic care management services provided by CHWs, thereby sustaining a workforce that is so needed in these days of COVID-19 pandemic. 2 West Virginia MCOs have also done actuarial studies that show that 47% reduction in cost, a savings of nearly $550 per patient per month. And those 2 health insurance companies are the Health Plan of West Virginia and Aetna, in case anyone wants to look up that information. In order for the CHW model to remain viable in Kentucky, we must have a sustainable stream of revenue as well. While most CHW programs are implemented with grant funding, we must move to a per patient per month reimbursement model in order to continue this important work and to improve the health and lives of the people that we serve. Today, we ask this committee to find this bill favorable and move it forward in the legislative process. In the words of the infamous Eula Hall, who I was lucky enough to get to work with for just a few years before she passed away last January, she was probably Eastern Kentucky's greatest health advocate. We have to fight like hell, those are her words, to provide the quality health services that all of our people in Kentucky deserve. I'm ready to fight for health care for all the people of Kentucky. I hope you're ready to fight with me.
And next, thank you so much. That just really helped explain this whole process. So I appreciate your being here. And then now we have Dr. Zarapata with us from KCTCS to talk a little bit about the healthcare worker shortage and what we're doing, this one small piece to address this issue.
Absolutely. Thank you very much. KCTCS is excited to partner with Representative Moser in developing the support structure for this much needed position. We already offer a community healthcare worker certificate. It's a 6 credit hour course. It's currently offered at Hazard, but one of the things we pride ourselves in is spinning these courses up quickly. We can deploy this at any one of our colleges across the state. We're a strong partner for the Cabinet for Health and Family Services in other areas, and we look forward to working with the Cabinet in this initiative. I'm happy to answer any questions.
Very good. Thank you all very much. Any questions from members of the committee? That's a very thorough explanation. With that, I'll entertain a motion on the bill. You have a motion. Is there a second? I'll second. Very good. We have 2 seconds. Very good. Again, this is a matter of a lot of passion. It's needed desperately. People that's going to help ultimately navigate a lot of folks. I would imagine things like this are going to help with, you think about things like maternal mortality, so many things that we need to improve on from a standing that I think a lot of times people just don't know how to navigate systems, and people that will help them, point them in the right directions and get them better health care outcomes. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll. Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes.
Aye.
Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 10-0. There is, we need to actually, now that we've got this bill as amended and it's passed, we need to go ahead and roll that into a committee sub for the floor. So we'll entertain a motion to do that. We have a motion. Is there a second? We have a second. All those in favor, please signify by saying aye. Aye. Anybody opposed? All right. So we have the bill now. It's amended. It's been rolled into a sub. Now I'll entertain a motion for consent on this bill as well. We have a motion and a second. All those in favor, please signify by saying aye. Aye. Very good. Congratulations.
Thank you so
Thank you so much.
I
Thank
really
you all.
appreciate all your help.
All right. And now we have the bill that I think will take a bit more time here in committee today. House Bill 777. I've had one member said it should have been renumbered 666, the mark of the beast, because it often has a lot of moving parts on this bill. That wasn't mine. It was someone, a member of the committee. I won't say who. This is an act relating to emergency medical services. The sponsors Representative Ken Fleming. I know we've got a proposed sub also before us, Representative. So if you'd like to, as you get settled and have members coming forward, I know there's a lot of people that would like to speak on this bill. We've got some time, but in the interest of time, people that come forward to speak, I'm going to ask them to try to keep the remarks as tight as they can. And I'm going to try to keep, we want to watch the clock just because there's a lot of action going on today here in the Capitol. We want to keep moving and make sure people can get to other meetings as well. So Representative, if you'd like to introduce yourself, the folks that are with you at the table, have them introduce themselves, and begin testimony when you're ready.
Thank you, Mr. Chairman. Actually, this is the one-armed bandit bill, 777. Okay, that's a bad joke. First of all, I'm Ken Fleming. I'm represent the 48th District in Jefferson County and part of Oldham County. And what I'd like to do, well, let me just go ahead and have other folks introduce themselves, and then I'll start.
Would you like to, before we begin that, there's a sub on the bill. Would you
Yes,
like
sir.
to go ahead and adopt that and get it out of the way?
Please do.
All right, so we have a sub that's been distributed. Everyone should have it as PSS 1. I'll entertain a motion on that sub. You have a motion. Is there a second? Second. Very good. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, the sub is before us. Please go ahead and continue with introductions.
I am State Representative Kim Mosier of the 64th District and primary co-chair, or not chair.
J.D. Cheney, Executive Director, CEO of the Kentucky League of Cities.
Nancy Galvani, President, Kentucky Hospital Association.
Representative Mark Hart, one of the co-sponsors.
Mr. Chairman and ladies and gentlemen of the committee, I do appreciate you entertaining this particular bill. I know it's been it's a difficult process going through. It's on eggshells, as the chairman has mentioned on a couple of occasions, and has been. But taking on any issue like this is not an easy task, and it's a task that's take a collaboration and cooperation from people to making sure that we put each other's feet in their shoes to understand where they're coming from and what their position are. And over the past several weeks, we have come to this House Bill 777, which I think is a good step forward in terms of changing and looking at EMS services and so forth. Now, some might say this has come on very quickly. That's not the case. This has been talking about for a couple years. I just happened to catch wind of this late last year. And for better or for worse, I got myself involved in this process. But I got involved for a couple of reasons. Main reason is people. When I have a friend of mine who looks me in the eye and says that their sister died trying to wait for transport. When I have another friend that his mother was put on hospice and had to wait in order to find themselves in the final days or even hours before they pass on. Or when I hear about a particular transport of organ barely making it to OR to save a life, that really affects me. And that really gets me to the heart of this issue, because that's what this bill addresses in terms of trying to attract and trying to help out those who are in need. I know there's some folks that are against this bill, and I respect where they're coming from. But I put people over anything and everything that I do, no matter if it's when I run a mental health center, or I'm a state representative, or when I was a council member on the Louisville Metro Council. I hope you received this. It's a sheet, 12 organizations. In fact, there's 13 organizations that are involved. And the coordination and cooperation could not have happened without everybody going through and pitching their ideas and thoughts in this process. I can tell you over 1,000, if not more than that, hours have been put in this process in order to make sure this comes to fruition. Let me go over the bill in particular, and then I'll ask my guests to comment on this as well. Kentucky EMS, or Kentucky Board of EMS, I think everybody realized that it has challenges, it has situations and so forth. And this is part of the process to help that board out. KCTCS basically oversees and manages the K-beams. They, upon their request, they have asked us to see if we can find a new home. And so we're transferring this organization into an independent agency in order for them to continue to function as they are, with maybe one exception, and that is handling complaints, handling issues that come up through those operators who provide ambulance services, to have that there handled by the cabinet to the OIG. The K-beams are still handled their complaints, still have their regulations. They will still do their duties and what they're doing. Now, part of this is on the back end of this bill, Section 23, is a task force. And I want to stress this to no degree. This task force is put together to look at additional issues and situations and concerns that came out of this several months of discussion. This task force will basically go through and try to further mold and shape EMS services, because if y'all are familiar with EMS, we've got next gen 911 coming down the pipe. And we've got to position our EMS services in order to make sure that we're in a good position. This task force and this bill will help in that process to get things forward. So like I said, this task force is putting it together, and it's a broad spectrum, and that's what this committee sub looks at in terms of when it came out of House. That's one thing we added to that, and what we added to that is the professional firefighters and the Kentucky EMS Association. Upon the request, we'd be glad to put them on there to get their value input. In addition to that, we've also put in there whoever the co-chairs of this task force will be, give them the option, in case we miss a stakeholder, to have them come into the fold and go through and address and help their situation out. So that's what it is. This bill also looks at data. I'm sort of a data geek. And I think this is a good move in terms of giving the cabinet access to K-Beam's data in order to go through and understand from an analytical point of view of what they come up with measurements and outcomes in order to have a good process in terms of regulations as well as policy and do that. So this data base that the cabinet will have will help basically help that out even more. One thing, the other thing I want to mention, actually a couple of things I want to mention, is that this bill also looks at transporting or helping out organ procurement organizations when they transport. Right now, they get caught in traffic. They have a difficult time, as I explained at the very beginning of this. This helps satisfy that by giving them a little more flexibility in doing that. The other thing, which I know is more of a sticky wicket, and that's the certificate of need. And we understand that's an issue that we have to address. There's several provisions in the certificate of need. You have to look at access, lower costs, and those sorts of things. One of the provisions is basically having access to those to transporting people from point A to point B. This basically helps give the flexibility of the city and county and hospitals in order to provide that accessibility, that additional care in terms of timeliness. So that's what we're trying to accomplish with this bill. With that, Mr. Chairman, I would like to have. I'm making sure I'm not missing anything off the top of my head. No, that's about it. I know there is one thing. I knew there was something about it. That is when we transfer or looking at transferring K-Beams to an independent agency, we made sure that the employees are taken care of. When I've gone through mergers and acquisitions and reorganizing companies, I'll make sure that are we improving the service? Are we improving the product? And second, are we taking care of employees and making sure that they are satisfied from a benefit standpoint as far as pay, those sorts of things. That also includes with that as well. So with that, I don't know who wants to. Mr. Cheney, do you want to go, or let's Miss let Nancy go first.
Thank you. So, good morning, Chairman Alvarado. Thank you so much for allowing us to be here today to support Representative Fleming's bill. And I'd like to echo that this is not a new issue. KHA began studying this issue back in 2019 when I had hospitals all across the state calling me, talking about how the needs of their patients were not being met. And we did a survey, and we found out the average wait time for patients to be transported was 7 hours. But many were waiting days, and many unfortunately passed away. So we set up a task force, and we met with not just representatives of hospitals, but long-term care. We had the Kentucky Board of EMS. We had ambulance providers trying to look for a solution to this problem. And so you might recall that we testified to the Interim Joint Committee on Health, Welfare, and Family Services last August, and that's when Representative Fleming came to us and said he would like to help us with this issue. And we reported to you that this problem was going on, and that many times when the hospitals called, the ambulance just simply didn't come. And of course, it was resulting in patient care issues, particularly for rural areas. And so our purpose in raising these problems is not to blame anyone, We understand staffing issues, staffing shortages. Hospitals have staffing shortages. But our purpose was to outline a problem that is growing and to make you aware of the efforts to address this and the need for House Bill 777. And I'd like to stress that this is a compromise, and there's no group here that's getting 100% of what they want in this bill, but we think it's an important step forward to addressing the matter. And importantly, as Representative Fleming has stated, it has a task force in here, so there are some things in the bill that we can implement right away to try to help solve the problem for our patients, but then we can have more discussions, collect more information, and then come back with more recommendations to the General Assembly. I'd also like to reiterate what Representative Fleming said, and that is this is not a hospital problem. It's not an ambulance problem. It's not a local government problem. It's a patient problem. It's the patients who are suffering here. And I think we all understand that we can't simply do things the way we've done in the past in the face of people's lives and health being in the balance. So we appreciate being part of the coalition of all the different organizations that are supporting this bill, and we strongly encourage you to pass this bill today. Thank you.
Mr. Chairman, I'll do as you requested, unusually, and keep my remarks brief. I think I may have to respond to some of the opposition. That may be my main purpose here today. But the Kentucky League of Cities, this was brought to my attention. It's unusual for us to testify in this committee by the mayor of Prestonsburg and our board of directors who has trained personnel in the city of Prestonsburg who are having to respond to requests or responses to dispatches, hold patients until the transport service, a private provider, can arrive maybe 45 minutes, maybe an hour later to transport their patients. For us, as I've learned over the last little bit, when we think about what city governments are, city governments and our local governments, they're designed to respond to the health, safety, and welfare needs of their constituency. And the difficulties that the city has had in applying for a certificate of need now over a couple of years, several $100,000 in terms of fighting that process, we think fundamentally that local elected officials ought to be able to respond to their constituents' needs. If people are hurting, if people can't be transported. So that's what engaged us in this legislation. For years, we've talked about the issues related to the certification and training of EMTs and paramedics. That issue, this bill takes a big step forward in creating this task force, dealing with K-beams to start that. So from a holistic perspective, and then when you couple it with the bill that you all just unanimously approved here with Representative Moser with 525, we're starting to deal with this personnel issue. But our fundamental interest in this bill is getting K-beams to the point where we can talk about certification, training of paramedics and EMTs. That is another small part of the problem, which this bill does. And secondly, enabling our local officials to serve those that they are supposed to be serving when it comes to their health and safety needs. That is fundamentally the role of city governments without having to go through a certificate of need process. And so that exclusion is in there. This has been quite the roller coaster, and we're only halfway through the ride. But we have worked in earnest, as they mentioned, with several groups on this, and we've come together and fallen apart multiple times on this language, and it's no small feat. And I hope y'all appreciate the fact that these 12 organizations have come together and agreed on language that addresses the issues and moves the ball forward, not only for city governments but for the constituents that we all serve together, our cities and you all of your constituents from a patient perspective. With that, I'll wait and probably have an opportunity to comment later.
I think I'll just chime in very briefly. I don't want to take up much time. I really want to be here to answer questions and to just be of support. But I've been through all of the iterations of this legislation. I understand the issues a whole lot better than I did a few months ago. And I very much appreciate the work of all of the stakeholders. It's been really valuable to try to understand this whole system. It's complex. It's there are funding streams that we don't all quite understand, and I think that that's why it's really valuable to have this task force to be able to continue these conversations and really help us understand how to best facilitate care for the patients in Kentucky. Kentucky is one of 2 states who have a CON process for ambulance services, and we're trying to get a better understanding of how the states who don't have CON for ambulances, how they make it work. And I think it's a really valuable conversation, and we've come to a good place. Like Nancy said, no party in this stakeholder group is 100% happy with the current bill, but I think it's a very, very positive move in the right direction. So thank you, Mr. Chair.
Mr. Chair, members of the committee, it's great going forth because all I can pretty much say is ditto on everything that was said. But I do want to emphasize this has been a major work, and it's still a work in progress, but a lot of compromise, a lot of a give and take, but it's an excellent first start, and it's going to get us where we need to be so that we can address some of the more complicated issues moving forward with crafting and recreating EMS in Kentucky.
And Mr. Chairman, I'll finish up, and I'll give you an example. For about 6 years, I was a member of a National Board of Directors, and 2 of those years I was president. And we represented over 160 firms, over 300 employees throughout the nation. My firm was only 15, so I was a small potato in that grand scheme of things. But I made policy decisions and implemented tactics that I knew wasn't really beneficial to my firm. But I knew at the end of the road that we would be better off because incoming tide raises all boats. And I think that each member that participated in this process took on that role. They understand the overall objective, the long-term objectives in terms of doing that. And I commend for each one of the people that I worked with and admire and respect that. And I look forward to working with them in the future, no matter what capacity I'm in, and making sure that we deliver health services and because we want to put people first. Thank you, Mr. Chairman.
Thank you. Okay, so I think what we're going to do next, before we start taking questions, is there's several people that have come here to speak on this bill. So I'm going to have them come forward. And while they're coming forward, I know we've got Jim Henderson here, who is with the Association of Counties, Judge Reagan Taylor, Judge O. Covington. We have Chris Runyon here with Scott County EMS Director. So if you all would like to come forward first, and while they're coming forward, I want to remind members this is the 3rd version of this bill that's been filed this year. So this has been worked on. I think we had one initial version that was, I don't know if it was withdrawn, but a second bill was filed, and now this is the 3rd iteration. What I've been told, there were 13 stakeholders at total working on this bill from the beginning, and there are 11 that are okay with it, a couple now that are not satisfied with where the bill is at. So again, I think that's why we wanted to bring it forward to get a full discussion on it. Gentlemen, if you'd like to introduce yourselves for the record, and again, please keep your comments tight, because I'm sure we're going to have lots of questions from members of the committee, but if you'd like to introduce yourselves and begin your testimony.
Sure. Thanks, Chairman Alvarado. Jim Henderson with the Kentucky Association of Counties.
Reagan Taylor, Madison County Judge Executive.
Joe Pat Covington, County Judge Executive, Scott County.
Yeah, and yours too.
Chris Runyon, Georgetown Scott County EMS Director.
Please proceed.
Chairman Alvarado, thanks so much. Obviously, we're probably one of those 1 or 2 groups that was mentioned. I think it would be best to hear from people who actually are in the business of being responsible for providing EMS today from the county perspective. So I'm going to let Judge Covington talk just a little bit first. Then I think Judge Taylor will take it, and then Judge Covington's EMS Director, and then I'll kind of wrap it up.
Chairman, committee, thank you all for having us and allowing us to speak to this. We'd all agree that EMS service is one of the most important functions of local government. county governments currently supply or are responsible for about 90 counties in the state by either having a service themselves or a direct contract or a taxing district. We take great pride in Scott County in our EMS service, and we're an outlier. We have an interlocal agreement with the city, and we function together and operate the EMS service together. And the county government manages it. The funding is split evenly. We have over 75. Last few years, we've had over 7,500 calls. Last year, we had over 8,200 calls. It's a huge, important service to our community, and we take great pride. And with all that work and all the counties that are involved, we really feel like there's two things that this bill needs to consider, and we want to address and consider. Right now, in Section 8, if a city wants to bypass the current process and create its own EMS service, this duplication would create a problem in my mind without having all parties at the table and trying to come to an agreement and having dialogue about that before going forward. A few years ago, in our own community, our local fire department leadership wanted to start a fire-based EMS. Fire-based EMS might be the greatest thing ever, but we had a great service going, and they went through the certificate of need process, and that did not move forward. I think it's just very important that there's dialogue between counties and cities at the table, and Section 8 doesn't bring that to the table for us. And then in Section 9, even more important, where a hospital in a local community wanted to seek a expedited certificate of need process, then only one local government has to sign off on that. And there's 118 hospitals in the state, and 113 of them are inside city limits. So most likely, county's voice would not be included in that process. And we just think it's really important. We have the vast majority of the skin in the game right now, and our voice and the county's voice and expertise in this process should be part of that consideration. So just being brief and direct, I'd ask you to include our proposed changes and vote no on House Bill 777.
Thank you, Joe Pat. Appreciate it. Mr. Chairman, committee, it's a pleasure and honor to be here with you all today. I'm Reagan Taylor, Madison County Judge Executive, and also the immediate past president of Kentucky Association of Counties. I'm here today to speak in opposition of House Bill 777. While I appreciate the work that's been spent on this bill, I don't think a lot of people fully understand how much this impacts counties. And even though some people are saying this issue has been worked on for 2 to 3 years, I know county officials were only recently brought into the discussions within the past few weeks. Like Judge Covington said, right now this is mostly a role and responsibility that falls on counties, on us. Like so many things we do as counties, no one else will do it. I wish the private sector could fix this problem, but doing public safety doesn't do much for your bottom line. That's why we have a special ambulance taxing district in Madison County. A special tax is needed just to fund our EMS services. Taxpayers are subsidizing this service because it isn't a profitable venture on its own. So the thought of the city of Richmond or Berea or our local hospitals getting into the EMS business puts real pressure on our current EMS service when you could potentially split up all the runs. I know some talking about this issue say it's all about patient care. Well, I'm here today, and we all want that. But I hope some of you on this committee also consider the cost shift that could happen to be more people getting into this business. There could be real pressure on counties or taxing districts to raise taxes just to continue providing the basic 911 EMS services. especially if hospitals or cities pick off all the better paying runs. I always hear here in Frankfort discussion about how expensive it is because of all the duplications of services. Why would we want more duplication in a county, especially where the EMS need is being met in my county? The officials who are best at making that determination are the local elected county officials. Since counties are operating EMS in over 80% of the counties, they should absolutely be involved in any process deciding whether cities or hospitals get into EMS. I know that there's supposedly this large group of associations supporting this bill, but I talked with my EMS director and his predecessor yesterday, and they said they felt that they had no choice in supporting this bill. I think they used words like they were strong-armed. We don't play that way in Madison County. If this bill isn't good for us, then we're going to say no. We want to work with everyone to help shape good public policy. But at the end of the day, our job and KCO's job is to make sure counties aren't hurt by it. Judge Covington already addressed our two big concerns. If we can get those fixed, then even though we still may not love everything in this bill, we can get to a place where we don't oppose it. I appreciate each and every one of you. I know this isn't an easy job, and I get it. And I can promise you all that it's no easier at the local level. We're all just trying to serve our constituents the very best way that we can. I appreciate y'all's time and consideration.
Mr. Chairman, committee, thank you for the opportunity to speak today. Judge Covington and I represent the fastest growing county in Kentucky, and as such, he alluded to the fact our call volume is up and we're facing the same staffing issues that healthcare across the nation is facing. It's a huge challenge, but and I think this bill does some really good things for EMS in Kentucky. As far as moving K-beams and creating a task force, I think that's wonderful. It moves EMS forward. Unfortunately, there is some potential for some real negative impact there as well, just with what's already been mentioned, that the county government not having a voice at the table as to what happens with EMS inside their county. So I hope you would strongly consider that. EMS is a unique animal, and I've been doing it for 33 years, and it's not uncommon for me to have conversations with folks, and they say, I don't know how you do what you do. I couldn't do it. And it's true, we are a unique profession, but the challenges that come along with that and the training and the demands of the job, frankly, this adds undue stress to us trying to do that job when then having to worry about what could happen with the future and being completely silent on the issue, not being able to come to the table to discuss those issues as they arise in our counties. So I hope you would consider amending that language to allow county governments a voice in those conversations as we move forward. I appreciate your time today and appreciate what you guys do. And thank you.
Chairman Alvarado, again, thanks for the opportunity to let the county's voice be heard today. I think these gentlemen have captured the essence of what we hoped to convey today. I think everybody who's been involved in this process has good intentions and wants to try to get to the same place. It's just we can't all seem to get there in the same way right now. As a way to bring closure to our testimony, I'll wrap up with a couple of comments. Another underlying concern that counties have in this bill, like a lot of other things that happen here, unfortunately, it often exposes the great divide here. And not just here in Kentucky, but really across the country. The divide between the rural and the urban areas. Some of our concerns are probably unfounded in Jefferson County, and maybe in the urban pockets of northern Kentucky, and maybe in Lexington. Some of the things we've raised here may not really apply in those places. Where you have large cities running full-time EMS and fire all together, I mean, most counties would like to be able to offer that kind of service in the rural areas. But you've heard from two county officials that actually represent two of the largest counties in the state. But what about my friend Judge Casey Ellis back here in the room who represents Owen County, a county of 11,000 that recently lost the service that it was getting from St. Elizabeth Hospital out of northern Kentucky because it just wasn't profitable. And so now Judge Ellis is putting hundreds of thousands of dollars into an EMS service because Nobody else will do it. And there are over 40 counties in the state that don't have a hospital. The EMS service in those counties is the only source of emergency care that people have. And that role often falls to the counties. There are just vast differences between the rural and urban counties on how this legislation applies. We just want to make sure we get it right. And every patient life matters. Whether it's one in Louisville awaiting transport from a facility to another facility, or it's a guy laying in a fence row on the back of his farm with his leg cut with a chainsaw waiting for an ambulance to get there. Those are equally important lives. And we just want to make sure we're not accidentally trading one for the other. And finally, I'd like to address what I would like to call a honest mischaracterization of KCO's role in this. I hope that's what it is. That's been floating around and fueled by a few folks here over the recent days. Shelley Hampton and I were at our very first stakeholders meeting on this issue on February the 10th, just a month ago. People keep saying this is a bill that's been worked on for 2 or 3 years, and I don't doubt that there are people who've been working on this bill for 2 or 3 years. I have no idea. We weren't part of that discussion. But at that meeting a month ago, it was still House Bill 505, an earlier version of 777. And it was dying a slow death even without our involvement in the issue. Fast forward to a couple weeks ago, and in one last attempt to rush to get something passed, a group of folks started working feverishly on a new bill over the weekend, Zooming, emailing, texting throughout the weekend to hash out what has now become House Bill 777. In about 48 hours, an entirely new bill was drafted, and on Monday evening at 8:30, I was copied on an email with instructions to get comments back by 10 o'clock. I and members of my team looked at it, tried to read it, make sure we were getting it right throughout the day on Monday, and by the next morning, I shared our concerns with the author of that bill that some of what was intended to be done didn't get captured correctly in the bill language. Unintended consequences, the misery of almost every bill. In fact, the bill language that we're talking about did not reflect the spirit of the discussion on the two most significant issues where counties were raised. KCO did not oppose the bill in the House in hopes that these issues could be addressed. We've consistently shared our concerns. We've worked to find resolution. We did not back up from our support of this bill. The support we offered involved specific county concerns that were not captured in the bill language. The two issues that have been addressed today. Our partners at the Judges Association, the Magistrates Association have worked alongside us to educate members in an attempt to find a solution. Our fixes are actually very reasonable, common sense solutions that just simply honor the spirit of our discussions. I really don't understand why we can't just get it right like it was supposed to be. Unfortunately, this is what happens when people are rushed to pass something here. There's a lot in this bill that's good. There's a lot wrapped up in one bill. Why not break out the parts that everybody agrees with and pass those parts separately? Counties would rather us not pass a bill than to pass one that doesn't get it right. There are good things in this bill. Why don't we vote on those? The last 2 weeks for us have actually felt kind of like a game of gotcha. And maybe they got us. If so, then we have learned a valuable lesson about this place, and counties will come out of this experience much better prepared for the next issue. Mr. Chairman, I appreciate you, along with many others on this committee. You've always been a gentleman to me, both in this role at KCO and in my previous role as Simpson County Judge. As it stands today, counties just cannot support House Bill 777. Thank you.
Thank you, gentlemen. We have 2 more people who want to speak, and I'm going to have them come forward at this time, and I'm going to ask them to keep their testimony. We're going to have several questions and comments. Jim Duke is here, and Paul Phillips. If you both would like to come forward, ask you both to try to keep your testimony, please, to 3 minutes or less if you can, so we can have an opportunity for questions and discussion. We knew this is going to be a tough topic. So if you'd like to introduce yourself for the record, please, and begin.
Thank you, Mr. Chair. And I had planned on keeping it to 2 minutes, so I'm gonna beat you just a little bit. My name's Jim Duke. I'm a paramedic. I've been in this business since 1982 when Senator Emery hired me for my first job in EMS in Ohio County when he was judge executive. Since then, I've always had a warm spot in my heart for county government and their roles and struggles in operating EMS services, especially in the rural parts of Kentucky where I come from. Since then, I've been involved with the Kentucky Ambulance Providers Association as in their leadership team since for the last 20 years. I've also been involved with the operation of other county services throughout Western Kentucky. I want to reinforce that the Kentucky ambulance providers are very much concerned about the viability of our ambulance services across Kentucky. We feel this bill will protect those services. And just like the judge from Scott County said a moment ago, a large portion of the services in Kentucky are provided by county governments and city county governments. Our membership as well is composed primarily of city county governments. So we represent those people. Our goal is to protect those services to where they can continue to be viable, can provide quality care, and do so into the future. We see this bill, House Bill 777, as a cooperation between several different groups to help keep EMS viable in Kentucky moving forward. We've got problems in Kentucky with destination issues. We've got problems in Kentucky with transport time issues. These problems are not widespread throughout the entire state. However, they're there, and we need to address them. And to do so, we need your help. And we feel like this bill is a good move forward to help that happen. And Senator Alvarado, I think I've stayed under my 2 minutes. If not, I'm finished.
You are right at it. Thank you, sir. Because I'm watching. People don't think, but I got the shickle in me now. I'm starting to watch everybody's testimony in here. So very good, Mr. Phillips. If you'd like to begin as well, I think we've got a letter also that you've distributed. All members should have that in their packet. So if some members want to make sure that they can read that at their leisure as well. Thank you.
Yes, sir. Thank you. And I'll either speak quickly or keep it brief. I am Paul Phillips. I am the regional director for Global Medical Response, which is the parent company of American Medical Response, Lifeguard Emergency Medical Services, and Air Evac Life Team, all of which operate in the state of Kentucky. First off, thank you for allowing me to speak on behalf of AMR and Lifeguard, and I appreciate the effort that has gone into crafting this bill. As was said earlier, it was no small feat, of course. Ground ambulance services across the state of Kentucky continue to take on substantial risk every day to respond to, treat, and transport patients to and from homes, accident scenes, hospitals, and other healthcare facilities. Our frontline responders have been nothing less than heroic in these times of need, especially in light of the COVID-19 response, and you've all seen it spotlighted with the response to the tornadoes in Western Kentucky on December 10th. However, our Commonwealth CMS system is facing a crippling workforce shortage at this time. It's a long-term issue that's been brewing for over a decade. Of course, the pandemic exacerbated the issue, but it's still there. American Medical Response and Lifeguard EMS appreciates the continued public support as well as the support of our legislature over the past few years. The workforce shortage has been particularly impactful in rural Kentucky. Lifeguard EMS currently serves the counties of Harlan, Pike, Leslie, Floyd, Knott, and Magoffin, and I can personally attest to these staffing struggles. House Bill 777 seeks to make some pretty bold changes to the statewide ambulance system, including allowing cities, counties, and hospitals to obtain a certificate of need to operate ambulance service without the requirement of a substantive review process. While we wholeheartedly support improvement in ambulance response and transport, we also recognize that these proposed changes are not targeted at the root cause, that being the workforce shortage. Nonetheless, while the bill enables cities, counties, and hospitals to obtain a CON through a non-substantive review process, it does not expressly allow those entities the flexibility to contract those services through a state-licensed ambulance provider. This would limit the ability to contain cost and capital expenses, receive the expertise needed to establish a service that is compliant with all state and federal laws, and provide the most economic solutions for the citizens of Kentucky. This action would also restrict private ambulance organizations from offering cost-effective services and clinical expertise to counties and cities. AMR and Lifeguard EMS would support an amendment to House Bill 777. I believe you all have it in the letter that was supplied, so I won't read it. This amendment would allow cities, counties, and hospitals the flexibility needed to find the appropriate resources when seeking to become part of the solution. Whether intentional or not, some of the existing CONs have been set up so that multi-county service area networks were allowed for adjoining cities and counties to share resources. This is a tremendous benefit to these areas that simply cannot directly or indirectly support an ambulance service on their own. This opportunity must be preserved. Public-private partnerships, shared risk, and financial resources and innovative collaborations are what is needed to begin to solve this problem. AMR and Lifeguard would firmly support such change for the benefit of healthcare facilities, government jurisdictions, and of course the people that we've all talked about today, which are our patients. I sincerely appreciate your consideration and support of this requested amendment and EMS in general, and I again appreciate the opportunity to bring our request to you this morning.
Thank you very much. All right. So I'm looking at the clock. I'd like to get everything concluded here by no later than 11:30, and we've got a few members who are going to have questions. So everybody who's testified, you may be called up to come and answer questions and for comments, and this is kind of a bill that's going to be somewhat in flux. I'll start off first. Everybody should have a copy of an amendment that I've prepared, and that as people come up, I'd like to hear their comments and their thoughts on this, because I think being involved in some of these discussions and hearing some of it, the worry is about the potential of negative consequences, the potential what could go wrong, and the worries that can happen. And I've heard the counter of that is, well, we've got this task force in Section 23 that, if you haven't looked at the composition, has 6 members of the General Assembly that will be part of that task force, Secretary of the Cabinet, the Inspector General, the Chairman of K-Beams, and then you've got obviously a mayor of a city, county judge that would be involved with that. I mean, it's a big task force that would be involved to have a lot of these discussions, which would be presumably a work group that would continue to work going forward. And so if the worry is that what we've got before us is not good and something could go wrong and what happens if we pass it, the amendment that I've proposed, that I'm not going to take action on yet, but I want everyone to see, is that it would basically allow this bill to be in place for the next 4 years, and then in 4 years it would sunset the entire bill and it would go away. And either we would have to come back and say things are working great, we're going to make it permanent, or it isn't working well because this task force will be working and we can reverse sections or change the law as we need to. So it would force the General Assembly to have to come back and address that issue. So I put that out there for members to know that if that's the worry of what things could happen, this is an option that we could have to force things to work well, and if they don't work well, then we have to come back and make changes, or if it works great, then we make it permanent. I'll put that out there, and as you come up, if you don't mind letting me know what you think about that. The first question we have is Senator Berg.
Thank you, Mr. Chairman, and I would like to thank Representative Moser and Representative Fleming personally for bringing this forward. I think I understand that there's different needs in the rural and urban areas, and that this bill may have a separate impact on rural areas, but I can tell you as a healthcare provider in urban areas, this is desperately, desperately needed. I mean, our transportation issues and our patient wait times seriously impact patient care. I think the pandemic brought that a little bit to the forefront with some really, really bad stories. But this has been an issue for patient transport, bed turnaround for a long, long time. And so I just want to say I appreciate you all addressing this. Thank you.
Thank you, Senator. And I think that comes down to that inaction really isn't a very good option for us. I don't think things are going very well right now. We all know that. The question is, what does a solution look like? And sometimes you don't want to necessarily fear of negative outcomes to paralyze us to not do anything, because we do need to move forward. Senator Meredith.
Thank you, Mr. Chair. And I'd just like to kind of give my personal assessment of the testimony I've heard today, and I want to echo the sentiments about Representative Fleming and Representative Moser. Put a Herculean effort into this, and I greatly appreciate it. And if you all pull this off, we're going to send you over to the Middle East, see what you can do over there. But I think one of the things that we haven't discussed in much detail here is just mentioned in passing earlier about the EMS workforce shortage. And that is a significant part of this problem that we're going to have to address. And I hope as we're formulating the budget that we will look seriously at appropriating some dollars directly to paramedic EMS training, because we know we need it. We've done it with nursing. I think we need to do it with paramedics and EMS as well. And I've heard the number thrown out of 10 million. I don't think that's an unreasonable number, and I know we have the funding there to do it. But another thing struck me about this, that, a problem that becomes everybody's problem becomes nobody's problem. And I don't know how we're going to craft legislation to address 120 counties and 424 municipalities in Kentucky. It can't be done. And while I appreciate some folks have compromised on this, obviously we don't have everybody at the table yet. And I'm to the point that personally, I'm not sure we shouldn't do away with this certificate of need process altogether. That is a little bit outdated. I think, was originally formulated was meant to keep from duplication of services, because the state and federal government had to pick up those costs, and we no longer have to do that. It's got a different role right now, and that role is to protect existing services within communities, and we should do that. But I think that responsibility needs to fall back to the counties and the cities, respectively. Each of us are different, wildly different, and I don't feel comfortable making a policy decision that's going to affect Prestonburg and affects my home county differently. And I really think we need to give serious consideration to this, is do away with the certificate of need process altogether and let those healthcare decisions be made at the county level, because you folks are in the best position to determine what those needs are. And it brings people to the table. I'm a little bit disturbed that we hear that a county may get into the business and it's going to hurt the county ambulance service. To me, that's unfathomable. Why would any hospital want to do that to Harmon County? Because we don't sit down at the table to talk about these things until we're forced to do it. So I think we're being asked to be a mediator in this situation. We shouldn't be. Every county is different, and we should respect that and make that responsibility go back to the county level to determine what the healthcare needs of your community are and how you're going to address those needs. So I wish we would give serious consideration to that. It's provides ownership for the problem at the local level, and that's where it should be. But, Mr. Chair, that's my comments.
Thank you. Senator Carroll.
Thank you, Mr. Chairman. And I think this may be one of those times that we find that room and lock everybody up till they come to an agreement. But I want to make sure that I understand. So the issue with this from the Hospital Association is that the lack of transports when patients need to go from one hospital to another, the wait time. So that is the most emergent issue that we have, correct? Yes or no? You don't have to get into detail.
Yes.
Okay. And with this, so with private services, are those services not expansive enough through the Commonwealth to be an option B if the local service is not going to be able to make it in an acceptable time? Is there another entity available throughout the entire Commonwealth that they could call if they were given that latitude to provide these transports?
Hospitals are calling. It's different services. In some cases, it's a private service. In some cases, it's a city service. It's different in different areas. But the problem is the services aren't coming, and we understand 911 comes first. But there's.
But I'm talking about as far as a backup from another entity that's not commonly used by that hospital.
I mean, hospitals, when that local service cannot call, they'll say, we can't come, and then the hospital will call additional services.
Okay.
We had one hospital that called 21 services and still couldn't get the patient moved.
I see.
So there's a need for additional capacity. And I'd like to point out that there is already the opportunity for counties and anybody that's opposed to have a voice in the process, in the CON process. The non-substantive review process is not an automatic approval. It's under CON. It's just you get a faster decision. And I'll read you from the regulations that say, if an application is granted non-substantive review status by the Office of Inspector General, any affected person, that's anybody, city, county, anybody, who believes the application is not entitled to non-substantive review status or who believes the application shall not be approved may request a hearing by filing a request for a hearing. And then that hearing is held according to a regulation that governs all CON hearings. So you go to a full-blown hearing in front of a hearing officer. Each party shall have the opportunity to present its case, make an opening statement, call and examine witnesses, offer documentary evidence into the record, make a closing statement, cross-examine witnesses. There is already a process in place for anyone to oppose. If a county is concerned what a hospital's doing, they can go to a public hearing. That's already the process. But what we're talking about and what's been suggested is that a hospital should have to run around and get a bunch of letters signed before it can even file an application. That's adding a lot of extra red tape. And think about some of our systems. And I'd like to point out in this bill, the exception for hospitals is very narrowly written. The only exception to CON is for a hospital to transport patients out of its hospital. It can't go anywhere else. It's out of its hospital. So if a hospital system wanted to have an ambulance to go through its various hospitals, it has to file for non-substantive review. Well, if you're St. Elizabeth Medical Center, for example, that has 4 hospitals in adjoining counties, what are you going to get 8 letters before you can even file an application? You know, that doesn't make sense. It's bad public policy when there's already a process. It's called a public hearing that you can go through under non-substantive review. It's the same hearing that you would get in formal review. There's already a process to hear anybody who's opposed to an application.
And just a final, are we certain that expansion or other services is going to solve the problem? I mean, I see at the base of this, you simply can't get enough paramedics and EMTs. I don't care how many services you've got. If you can't staff them, that is the core of this issue. Do you agree with that?
That's part of the issue, but I will say, reiterating Senator Meredith's comment, 48 other states don't have certificate of need. Hospitals are not out to get everybody in the ambulance business, but hospitals have no option today. If they can't move their patients, there's nothing they can do, and that's an issue. When I looked at Tennessee, it's a CON state, but it does not review ambulances. It's a rural state. Everyone's coexisting. There's county services, there's city services, there's fire services, there's private services, and there's a handful of hospital services. Not very many, but a handful. It's just another option.
And Mr. Chair, if I could just take a moment to address the staffing issue, and thank you, Senator Meredith, for your comments. We fully understand that staffing is an issue, and this bill does not directly seek to address the staffing issue, but we do have other legislation which is hopefully coming to this side of the chamber or to your chamber soon that will address specifically the healthcare worker in a loan forgiveness program, additional scholarships and training for a long list of healthcare providers, including EMTs and paramedics. So we are working on this issue. I would just like to reiterate what Nancy said, that this agreement for the hospitals is really specifically tailored to move a patient to a different level of care between facilities, between hospitals. There is nothing in this legislation that would allow a hospital ambulance service to go outside of that their jurisdiction and provide 911 services. Now, I mean, I have a bit of an issue with, and I greatly respect KCO and their concerns. Don't get me wrong, I fully understand their issues, but I don't think the answer is for Frankfort to come in and dictate interlocal agreements. That's what should be happening. If it's not happening, I mean, we can come in and micromanage, but I don't think that anyone wants us to do that. And I'll just, once again, talk about the CON process. I initially advocated for eliminating ambulance CON altogether. I think that this is a self-correcting issue. I think that the free market would certainly help dictate with interlocal agreements and everyone working together. This is a problem that can be solved. This is a first step, and I think that we can certainly continue these conversations in the task force. Thank you, Mr. Chair.
Very good. We got 2 more members, actually 3 more members who want to speak. Senator Nemes.
Thank you, Mr. Chairman, and thank you, Representative Fleming, for bringing this thankless, important subject. But my question is with you, Mr. Chairman, and you're most knowledgeable and respected, but could you answer why we need an amendment to with a sunshine clause when we can come back and do this anyway?
Well, it's just, again, it was an option, and I think you're going to hear some other options. So this is just, I wanted to put this on the table. We've had meetings about this outside of this room that I've talked to all the groups involved, and you hear the opposition. And so if there's concern, if there's a solution, we'd like to have it, like to have these groups come to a solution. But if there isn't, the option is to consider passing this with a sunset so that we are all forced to come back, and it gives this bill an opportunity to work. Because some of the worries about what potentially could happen. So we said, okay, that will flush out. If it blows up and doesn't work well, then we'll be forced to come back and have to readdress this. So that was the thought. I'm not going to call action on it. I just want it to be out there so that everybody's aware. I've drafted it so that it's a possibility. That's the key thing. Senator Howell.
Thank you, Mr. Chairman. I had a quick follow-up, and I apologize. Maybe we should get a guest list on it. I do not remember your last name.
Galvani.
Okay. You had mentioned something about you had studied Tennessee, and there were just a small number of hospital-run services. Where were those? Do you recall what areas of Tennessee those were located in?
I can't tell you entirely. Some of them I recognize. Vanderbilt had 5 licenses with several children's hospitals. They seem to be systems, larger systems, but I'm not familiar with where all they were. But I just looked at the ALS and the BLS services in terms of who had the license and just looked at the composition.
Okay, thank you. Thank you, Mr. Chairman.
Okay, before we have our last question, Mr. Henderson, you may want to come to the table just to make sure we've got everybody up here if there's any other discussion. Just grab a chair and pull it on up. That way we can have all members of the table. Senator Givens.
Chairman Alvarado, thank you for the chance to ask a question. Thanks for your leadership in this robust discussion we've had. And I want to start by thanking everyone involved on both sides of the issue, especially my legislative colleagues, the 2 here at the table, but particularly Representative Hart. As I had a member of leadership talk with me, in fact, this morning as we were discussing this legislation, and some of the ideas that you brought to the table in the last few moments apparently were game changers. So thanks for investing in this effort, to all 3 of my colleagues especially. In listening to the debate and discussion and obviously getting lots and lots of input from parties on both sides, it's interesting to me that the substantial review process is failing so badly if we have the access and the destination questions that people are bringing to the table. So I'm very curious to investigate, and I'll look to the 2 chairs of this committee and hope that potentially over the interim we can have a robust discussion about the substantial review process and why it would fail to certify services if we have access and destination issues that we've heard about here. In addition, I think the CON question is interesting in and of itself, and so the first change that I'm going to suggest we consider actually goes to the task force on page 58, Mr. Chairman. If we do move changes into the process, I would encourage that we have a new A under the charges for the task force, because we charge task forces to do specific things, and they're measured by the things they do. And I think Senator Meredith spoke to this beautifully. I think A should be review of the need or lack of need for CON process in ambulance service. Now, there may be times that we want to do away with CON, but be cautious, because if we discover doing away with CON works quite well, we could become really big fans of doing away with CON in lots of other places. So for those proponents of us eliminating CON, I advise caution. A thought there. The other change, 2 changes that I'm going to propose we consider if we do make changes, Chairman. I think the AMR conversation and the language that was brought to us, it looks to me to be something that we absolutely should do, notwithstanding any section. Nothing within any section or subsection prohibits any person, city, county, from entering into a contract or agreement with a licensed ground ambulance service. So I'm a proponent of that AMR amendment being worked into some changes if we do those. The last change that I'll have, I think, goes to the core of the conversation. And staff has been very skilled in assisting with thoughts around this. And this is not a fully formed idea, Mr. Chairman, but I would love the chance to engage in a conversation on page 29 briefly. There at the bottom of 29 is the heart of the question about the city or county, that city or county piece. Now, others have worked on this so much longer that I don't even presume to walk into this room and offer something that's finished and well thought out. But I'm proposing we consider, Mr. Chairman, changing the city or county to city and county. Both have to approve. Now, in a division of the House, meaning there's not agreement, then we move into a different process that starts, in my mind, with the non-sub review. And if the non-sub review says this need is real and this service potentially should be provided, then I've already started a conversation with the cabinet about a fully expedited but fully substantive review that has to disprove that need. It's a little more robust than just a hearing. The cabinet's already started engaging me in the conversation, and that effort would have to disprove what the non-sub review has approved. And so I appreciate the work everyone has done. The chairman's admonition a moment ago in a very positive way was that maybe everybody, or maybe someone else said it, maybe this is the point in time when everybody gets in the room for an hour and a half together, or 3 hours together, or 5 hours together. Most of those best decisions are made after 8 hours of no water. No restroom breaks. People are motivated then to come to consensus. And I say that in some jest, but also in some seriousness, having seen this work in other situations. And so, Mr. Chairman, I would encourage, we have days left in the session. I'm going to be a proponent that we pass over action on this bill today and go to work on it for another week or 10 days or whatever it may take, but with the full knowledge that action needs to happen before the end of this session. Thank you.
Thank you very much. Any other members, any other questions? So what we've got before us effectively is we do nothing, which I don't think is working very well. We pass this bill as it is, and it goes forward, and people will be upset, and there'll be some opposition. We pass it with a sunset clause, which is one option. Fourth one, which I don't think will be done before the end of session, is to get rid of CON altogether, which I think is what happens in most parts of the country. And for those who worry about how that would work, I would argue you have plenty of examples of how that works. But as Senator Givens said, that does set some precedent potentially for other things. Sounds like Senator Givens has a proposal that may have some merit as well. It might be worth considering. And those are all the things. I've had other members, you've seen me have some conversation, others who are concerned about not moving this forward quite yet and maybe giving us another week to work on it. We've got at least 2 more weeks, and we could always call special meetings as well if we need to, as long as we have the time to do that and get the room to do that. But that might be the best approach. Senator Adams.
Thank you, Mr. Chairman. And I know that there's, I can hear some consternation in your voice on this issue. First of all, I'd like to thank the bill sponsors for bringing this. And I'm prepared to vote yes on this bill today. But in deference to our colleague on this committee and the proposal that Senator Givens made, I would think maybe we have the opportunity to take one last look at it. I do think this bill has the votes to pass in committee today, from what I understand. Let's go ahead and take a look. But this is kind of directed at the testimony that I received from KACO. And that is, it's not about you, it's about the patients. And it's about transporting that patient to the place where they need to be. And it's not about anything other than that. And I think sometimes we're losing that patient in this whole conversation, and that person cannot be lost. So if it's okay, Mr. Chairman, I propose that maybe we pass over this bill until the parties can get back together again.
Very good. Yeah, Senator Wise.
Thank you, Mr. Chairman. First, just want to thank all the bill sponsors here. I want to thank all the testimony. We've got friends on all sides of this issue that came and testified today. I would also like, from what I would refer to as Senator Obi-Wan Kenobi Givens, with his wisdom and with his foresight on this issue, with going forward with the proposal as it is. I do think this is a issue that so many people have got passions about, and I do think that if these people can come to the table and work on, this is something that definitely can be discussed in the coming days ahead. Thank you.
Senator Nemes.
Once again, the most respected Senator Givens. I have to disagree. We've been kicking this around for 14 years, and we're going to kick it around another week, and then we want a sunset clause to kick it around some more. I think we're here to make decisions. I'd like to vote today, and if you want to hold it up a little bit longer to put a committee or floor amendment on it, then that's an option.
Thank you. Senator Berg.
Honestly, I too would prefer to vote today. I think this is a really important patient care issue. And to begin with and to end with, the patient comes first. And when we have people waiting literally sometimes days to be transported, and you know, not every one of these is an actual crisis medical emergency like somebody's going to die. Some of them are. I mean, some of them actually are. We've had surgeries performed at hospitals in this state that aren't equipped to perform those surgeries because we couldn't transport patients, okay? We also have mental health crises, patients that need to be in an appropriate facility that are waiting 72 hours in an emergency room, guys. No, it's not okay. I know it's not perfect. I know there are people who are thinking they're going to lose. But in the meantime, we have a real issue here. So if we postpone the vote, I would beg that we come back and resolve this by next week.
Thank you. Senator Howell, last comment.
Thank you, and thanks to everybody that's worked on this. This has been an issue that lasted longer than the 14 years that Senator Nemes spent. Before I moved back from Chattanooga, I was working with my local folks in home over EMS, and I have a different view on patient care and this of being about the patient. In parts of my really rural areas, patient care means having an ambulance at all to move patients, and this is something that we've struggled with well before any of this stuff that y'all are talking about now came up. And I just I'm lost in the supply demand cycle on this as to how we can increase the number of ambulances and EMTs into an area that already struggles to pay for this service and help that existing service be more viable. My concern is that if we do this, there's going to be some areas that are so disaffected that it may collapse our EMT system completely. And that's why I think we need to stop and take another quick look at this before we move forward. I understand the issues on both sides, but this is an issue. My local hospitals and most of my EMT are in favor of this. And I would be voting to take this out of committee today, but I think that's something that we probably need to take a quick look at. Thank you, Mr. Chairman.
Thank you. Okay. We've heard a lot of testimony. We knew this was going to be this situation. Here's what we're going to do. We're going to pass over this bill today, but here's what I'm asking the parties at the table and those who are involved with some feedback. We've got a clause from GMR. I'd like to have all of your opinions on that clause. And there's been a member who's expressed some support of that. Sounds like Senator Givens has a proposal. Senator, if you'd like to be able to, if you have that in writing, is to either get that to those that are at the table. I'd like to get your feedback on that. The idea of a sunset clause on this, I'd like to get your idea about that. Your idea about a CON abolishment altogether, and get your opinions regarding that topic. I'd like you all to meet and have a decision to me by Friday afternoon so that we can decide how we're going to move forward with this, because I think we need to have everybody reach some kind of a conclusion. This is normally, I get all these folks that are state and local people most of the time that are here before me in this committee, which is a little bit different, but that's what I'm going to charge all of you to do, is to sit down. These are the top, you've heard all the testimony, almost everybody spoke on this, and this is good. This is kind of the whole committee airing out their opinions and their positions on it. And I think, this is a committee that is about patients first. We tend to pass a lot of nonpartisan legislation here that is targeted towards improving the health care and the outcomes of people in our state. And that's really of paramount importance. So I'm going to charge all of you to do that, get together, cover those topics, and then come back with a report by this Friday. All right, very good.
Mr. Chairman, when you say report by Friday, and what's the next plan of action?
I mean, we have time still to hear this bill going forward, but I really don't want to have another hearing and hear testimony on this topic. I think we've gotten our ears full today on this topic. I need to have some kind of plan of action or some resolution as far as agreement from all parties on this. And if they can come back with an agreement on it that we can all be agreeable to, then we can look forward towards taking action later on, because we still have a couple more weeks to get it done.
Thank you.
All right. Thank you all very much for your participation. Thank you all for being here today. I appreciate all the testimony.